Hi, my name is Sophie Goff, and I will be responding to scenario 2. So this scenario poses some conflicting ethical issues. The ethical code of conduct includes values such as respect, integrity, honesty, openness, and promoting autonomy and well-being. Promoting patient autonomy means allowing patients to make their own informed decisions about their health and treatment. On top of this, patient-practitioner collaboration means that both parties should be involved in decisions. Beneficence and non-maleficence are two principles of ethical practice. They are underpinned by evidence-based practice, which ensures that patients are receiving care with evidence to back up its selection and use. These typically include studies and trials which support or negate its efficacy. Furthermore, the principle of doing no harm is compromised when providing a treatment that I do not agree with or understand. Legally, this scenario demonstrates negligence of the practitioner. Whether the treatment was manual therapy or exercise prescription, it was not considered clinically credible or reliable. This is because it does not align with any reputable evidence-based practice, which is used to guide practitioners to deliver best practice. As a result of this, the outcome of this therapy may cause harm or damage to the patient. Negligence of this sort can severely damage a practitioner's reputation, the patient's physical capacity, and lead to lawsuits. The Australian Health Practitioners Regulation Agency Principle Number 7 is minimising risk to patients. This incorporates using evidence-based practice to guide treatment to ensure patients receive high-quality care. In this scenario, the therapist fails to do this by compromising their standard of care to enable autonomy of the patient. This scenario does not adhere to several elements of the Australian Physiotherapy Association Codes of Conduct. This includes providing good care. This incorporates working within your scope of practice and in alignment with the current evidence-based recommendations in your health profession. Furthermore, the code outlines the importance of shared decision-making. This includes a practitioner's right to refuse treatment to which they believe is not beneficial or safe to provide. Partnership with patients, which allows them to be informed about their health and their subsequent decisions about their health, is another code that is not adhered to. As outlined by the patient, they do not feel that the options were appropriately explained. This links in with the importance of informed consent, which enables patients to make informed decisions about their healthcare and understand comprehensively all their options. When a complaint is made, it is important to respond with open, prompt, respectful communication. In this case, the Australian Health Practitioners Regulation Agency are requesting an explanation. In this explanation, the physiotherapist may outline that they were acting in line with the patient's wishes. However, it is important to acknowledge why this was not the best course of action for the reasons we have just mentioned. An apology should be made and should the patient return, a professional and open discussion should be had regarding the benefits of evidence-based practice. In future, to avoid a scenario like this from arising again, there should be a strong focus on improving the communication between the patient and practitioner. This includes strengthening explanations on what evidence-based practice is, such that the patient understands that there are trials that support the different practices. This is different to the lab-based experiments that the patient thought was happening. Furthermore, an in-depth explanation should be done explaining the chosen treatment so the patient has an understanding of what it is, how it will affect them, and why it is done. Finally, if a patient continues to disregard the evidence and explanations, the practitioner should maintain boundaries and not be pushed into practicing something that goes against their understanding of their profession. This allows the practitioner to uphold their code of conduct.